Welcome to RUMC Connections. Welcome to RUMC Connections. My name is Meredith Gaskins, and I'm joined today by Dr. Fiona Shehai, Chief of Women's Cardiovascular Health at Richmond University Medical Center. Thank you so much for joining us today.
Thank you so much for having me. It's a pleasure.
Of course. So through RUMC Connections, you will meet the fantastic doctors, nurses, and medical professionals that make our hospital thrive. We'll also provide you information about your own health, explore the latest medical trends, and hopefully get you answers to some of your own health-related questions. So when you visit Richmond University Medical Center for cardiac care, you put your heart in the very best hands, truly. With support and sponsorship from the nationally recognized Mount Sinai Health Network, our cardiology physicians, nurses, and technicians have achieved reputations of excellence, and we are dedicated to respecting the dignity and well-being of each individual. We offer comprehensive inpatient and outpatient service, from emergency care to sophisticated diagnostic and therapeutic procedures for cardiovascular screenings. So RUMC's cardiology team truly provides an exceptional level of expertise and attention. On this episode, we will explore why heart disease is the leading cause of death for women, the unique symptoms women experience, and why these signs are often overlooked or misdiagnosed. Dr. Shehai will explain all of this and discuss some prevention strategies, including lifestyle changes and the importance of regular screenings tailored to women's needs. So just to give you a little background on Dr. Shehai, she first graduated from the SUNY Downstate College of Medicine. She then went on to finish her residency with the SUNY Downstate Medical Center in Brooklyn. Dr. Shehai completed her postgraduate training and gained her fellowship in cardiology at the SUNY Downstate Medical Center, serving as chief fellow during her final year. So Dr. Shehai has achieved board certifications in cardiovascular disease and internal medicine. At RUMC, we are proud to have her as our Chief of Women's Cardiology, and women's heart health is her specialty. She provides expert management for heart failure, works with advanced cardiac imaging, and continues to educate medical students and residents. Thank you so much again for joining us. And if you could enlighten everybody, can you start maybe by telling us why heart disease is often called the silent threat for women?
Well, thank you, Meredith, for that wonderful introduction. I truly appreciate that. Thank you. So yes, we'll delve right in. Heart disease is definitely a huge part of our lives, and 1 in 3 women essentially are affected and die of heart disease every 80 seconds in this country. It's definitely it affects women disproportionately when comparison to other health issues. Heart disease kills more women than any cancers combined, more than any accidents, more than anything else in this country and developed world. Definitely, it's definitely a topic that we need to explore a bit further and be aware of as well. Heart disease is in women. Heart disease is definitely something that's not as taken care of as much as other health issues. For example, if you ask a woman what their fear is, not always will you get the answer of heart disease. You might get breast cancer, ovarian cancer. Those are the usually big things that women are worried about. So it's time that we definitely educate women that heart disease is the number one issue in their lives, and there are things to be done and things to screen for and treat for, which can truly change the trajectory in their health.
What inspired you to specialize in, women's cardiovascular disease?
I think it's the disparity that I saw throughout my medical schooling, throughout my training. Internal medicine is definitely the gateway to cardiology, but women cardiologists essentially make up only 15% of physicians in this country. So there's this disparity that starts off right there. And then also, as I got to learning about cardiology and cardiac diseases, I saw that there's a disparity not only in physician cardiologists, but also in the patient populations as well. So I was definitely drawn into it, and definitely something that I'm very passionate about, and I'm a very big advocate for women's cardiovascular health.
Heart disease, like you said, is the leading cause of death for women, yet so many women are unaware of their risk. Why do you think that is?
I think it starts off decades ago when women were not represented so much in medical research. This goes back to even the 1970s. It was seen as women, because of their menstrual cycles and because of their fear for pregnancy or being pregnant during the studies, they were not necessarily started to be explored in these research groups. So women at this time, we make up about 50%, 48% of cardiovascular disease in this country, yet only about 38% of us are included in research studies. And this is in modern times. But going back even earlier than the 70s, women were not included in medical research. And heart disease was seen as a man's disease, not so much a woman's disease. And then that was perpetuated even more when the FDA released a statement in 1977 stating that it's actually against women's health and against the health of the baby for women to be included in research studies. It wasn't until 1993 that Congress passed a law mandating that women are included in the study. So it wasn't so far as in the 1990s that we were starting getting included and getting including this research study. So we are so far behind when it comes to other groups that are being that have decades of research under their belt. So women we're definitely falling behind when it comes to that. And then furthermore, it wasn't until last year that President Biden actually passed an executive order stating that we must still perpetuate that we need to include more women in studies as well, and more comprehensive health, more screenings. So essentially, we're still struggling to be included in these groups of being researched and having medications and testing.
Wow. That's scary and surprising
Sure.
hearing statistics like that. And I'm sure that attributes to why there are so many women who are, being
Absolutely.
affected by heart disease. Hopefully that's something that continues to change
I hope
as
so.
the years progress. So what would you say some of the unique risk factors for women are that, we may overlook, like pregnancy complications or hormonal shifts?
Absolutely. So still the traditional risk factors apply, things like high blood pressure, high cholesterol, diabetes, smoking, obesity. So those are usually the big chunk that affects women. But women also are affected with pregnancies, for example, with gestational diabetes, preeclampsia, and high blood pressure during their pregnancies. And these are risks that not only affect women during their pregnancy, but they can sometimes increase their risks for further heart disease after this is all long gone. They can increase tenfold. For example, gestational diabetes can increase your chance for diabetes in life thereafter at about threefold rate. And diabetes is a well-known factor for heart disease as well.
And what role do genetics and family history play in women's cardiovascular risk? And, can anything be done to offset this risk?
Sure. So the studies are still ongoing in this area as well. I would say not only in women, but in just the general population. 80% is environmental, things like what I mentioned before, like high blood pressure and diabetes. But about 20% still is genetics. And that's also true to women as well. So those are factors that unfortunately are not easily be changed, but they are treatable. And they are treatable as earlier on in life as well. So it's very important that we have these conversations and this conversation like we're having today to make women more aware of the risk factors so they can get checked earlier on in life as
Earlier
well.
screenings.
Absolutely.
Okay. If somebody had a genetic, risk, what age would you recommend that they begin screening?
Sure. I would say early, even in childhood, it's beneficial to screen
Okay.
at-risk children for heart disease. I've heard of stories where I've had young women come to me and say that their child at age of 5, age of 10 have high cholesterol and needed to be on cholesterol medications. So age is really not a hindrance to when it comes to screening for heart disease. So earlier on, and a good history taking by not only adult physicians, but also in pediatricians' offices, it's helpful to have these discussions with the family, with the parents, in order to see what the family history is like, in order to tailor the kids' screenings as well. So earlier the better for sure.
Earlier the better. Oh, that's good to know. And then make them annual screenings.
Yes.
Okay, great. And, how do life stages like menopause increase a woman's risk for cardiovascular disease?
Sure. We know that estrogen is definitely cardioprotective when it comes to women. So as women enter the perimenopause stages of their lives, we see a precipitous decline in estrogen. And so then the risk factors for heart disease thereafter, they definitely speed up. So we're seeing more women after the age of 50 start to be inflicted more with higher and higher chances for heart disease.
Wow. When, women, I've heard, often experience heart attack symptoms differently from men. Can you explain some of these differences?
Yes. And that is going back to what I mentioned before
Yeah.
when it comes to studies and research in the past. The traditional risk factors for heart disease and symptoms, those were mostly studied in men. In
Right.
women, we know now, and we're starting to get to know a bit better, that women tend to present in not as severe ways with their symptoms for heart disease. Cardiovascular heart disease uh, cardiovascular arterial heart disease is one of the big chunks of the under the umbrella of heart disease. So when women present with heart attacks, it might not be as severe as a man complaining of chest pain that's radiating to the left arm, that's radiating to the jaw. Women might present in the same ways, but maybe not as severe pain.
Okay.
That women present with a little bit more vague symptoms such as nausea, vomiting, upper back pain, the feeling of anxiousness, palpitations, or racing heartbeat. We might present as fainting episodes instead. So it's very important to listen to these cues in women and not dismiss them,
Yeah.
because a dismissal could potentially mean higher rates of mortality and morbidity moving forward.
Okay. So don't ignore your warning
Absolutely.
signs. Okay. So are there any ethnic or genetic factors that make certain groups of women, maybe more vulnerable to heart disease?
Yes, that's definitely one of the areas that I'm trying to be a bit better educated in now as well. Women across the board are definitely more underserved, but there's no more underserved group of women than a Black woman. So definitely, it has to do with a few things:
Hmm.
biographical, socioeconomic statuses, environmental statuses as well. So it's up to the physicians and up to the providers in order for us to learn these disparities and better tailor our health and our screenings and our discussions with these group of women as well. So minority women are definitely much more affected and in more severe ways with risk factors for heart disease and heart disease in general. So definitely we need to get better educated when it comes to these issues.
Hmm. Why are these symptoms frequently misdiagnosed or, dismissed even by medical professionals?
Sure. And again, it goes back to the same kind of thing where research and
The
studies are
studies.
more done in the white male, for example, in the male population as opposed to women, and tailoring these symptoms to women as well. Along that, there's stigmas that are connected to women. If a woman complains of something, they're seen as much weaker, as opposed to a man complaining of a certain symptom or of a certain risk factor. With that is also connected, going back to Black women, that stigma of the strong Black woman. So it's almost like not taboo to
Hmm.
complain about something or go see a medical professional.
Yeah.
And that's very unfortunate because, again, women make up half of the population and half of the population with heart disease. So it's time that we really educate ourselves in order to better serve our community.
What role does intuition or, knowing your body play in recognizing when something isn't right?
Sure. So we all have those symptoms where we may not feel well a couple of days here and there, but it's definitely important to be in tune with your bodies, to not ignore certain signs and symptoms just because it might not be something that you think it could be serious. It's
Yeah.
definitely worthwhile having a discussion with your medical provider to see what else it could be.
Hmm.
Because that nausea feeling or that racing heartbeat, it might not be anxiety. It might not be not sleeping well. It could potentially be tied to a risk factor for heart disease or to the beginning stages and those sentinel signs of something else being wrong as well. So it's definitely, you have to be your own self advocate when it comes to these feelings that are just not sitting well with you.
Okay. And can you explain the connection between conditions like diabetes and cardiovascular risk in women, being that diabetes continues to rise in this country?
Absolutely. Diabetes, unfortunately, is tied to multiple risk factors, not just for heart attacks and heart failure, but also strokes and peripheral vascular disease as well. What diabetes does, and continued uncontrolled diabetes, it causes inflammation inside our blood vessels. This makes it easier for plaque buildup to happen, for plaque buildup that is occlusive or can cause heart attacks. Heart attacks can then lead to other sequelae to heart disease as well. So it's a very vicious cycle when it comes to not getting those risk factors under control. And diabetes is definitely in the rise in this country for multiple reasons, of course, but definitely something to really kind of be more aggressive in treating as well.
What role does weight stigma in healthcare play in the prevention and treatment of heart disease for women?
Sure. Weight stigma is we're seeing this more and more. Unfortunately, over half of our population is obese, especially on Staten Island. We see a very when compared to other boroughs, we definitely have a higher population of overweight and obese patients as well. There's a stigma that a heavier patient maybe is not taking care of themselves. Maybe they're not compliant with their medications, and there's that shame that when they go to the doctor's office, they're going to be judged for how they look. So they rather not go through that. They rather not have that almost like the bullying that they've been going through for a long time. So with that, also they're lacking in getting their medical care that they need. They're lacking in getting the medications that they need, the advice that they need, the nutritional health that they need as well. So definitely, it's a lot of shame in this country, a lot of judgment in this country when it comes to patients that are heavier.
Okay.
So
Yeah.
that, in fact, I would say is a risk factor in and of itself, besides obesity too,
Oh, of
is having that
course.
stigma.
Yes, absolutely. Now, how should women, approach regular checkups or screenings for heart health, and what age should they start if they maybe, don't have any risk, in their family?
Sure. So I would say age of 40 would be across the
Okay.
board something that would be helpful. But again, it goes back to having these discussions with your medical professionals to see at what age you start the screening because, again, it's not one of those things where it just fits everybody. You have to know your family history. You have to know what has afflicted you in your life so far, risk factors like in pregnancy, as we mentioned. So definitely, it's tailored to each woman.
Okay.
It's best to have a conversation with your medical professionals based on your history so far as to what suits you. So it's not a one size fits all kind of thing. It's very much tailored to each patient. But I would say age 40 is definitely a good number. Age 20 is better. That's when I think it's a good idea to have blood tests that screen for high cholesterol, for diabetes, to have your blood pressure checked as well. So those are the main things that definitely will play a role in life moving forward.
Okay. Are there specific exercises or diets, that are particularly beneficial for women's cardiovascular health?
Sure. I'm a big advocate that any exercise, any
Uh,
movement is good for the body.
mhm.
In our lifestyle so far, of course, everybody's busy. We have multiple jobs. We have families to take care of. We're caretakers sometimes of family members as well. So it's not so easy to just carve out this 1 hour a day to go to the gym and do something. Also, again, going back to the stigma as well, being heavier might not necessarily be something very pleasant going to the gym and having those people look at you and maybe not knowing how to work a certain machine. So any movement, whether that's a walk during your lunch break, whether that's taking the stairs, whether that's parking your car a little bit further out to get to where you're going to take a walk, definitely any exercise is good exercise. But I would say at least about 150 minutes of exercise within a week's time is the number that we should strive for. And when it comes to diet, the Mediterranean diet has been proven by research that it's the best diet to follow. And that diet is basically it forces not forces, but it it emphasizes more healthy eating, such as legumes and beans and lower refined sugars, and just simpler eating without the sauces, without the extra things, and less on the dairy and less on the animal products and red meats. So definitely, Mediterranean diet is something to follow. The DASH diet, which is essentially the Mediterranean diet by low salt, is helpful for people that have high blood pressure. And any movement is good movement as long as you're doing something.
Absolutely. Especially with the amount of sedentary lifestyles that we have
Absolutely,
today.
yes.
Gotta
Working
move.
from home is one of the big things, and it's unfortunately
Yeah.
it's definitely we're causing our bodies to undergo this situation where we're putting ourselves at risk
Oh, yeah.
for
Sitting is the new smoking.
absolutely yes it is well said.
Absolutely. So, okay, aside from that, how can women navigate the hormonal therapies like menopause or, protect their heart?
Sure. So hormone replacement therapy is definitely something that we've been trying to kind of gauge as to which women would fall into the category that would benefit for hormone replacement therapy. It's not something that will affect and improve every woman across the board, but definitely something to have a discussion with your primary care or your gynecologist regarding this arena. Hormone replacement therapies can sometimes increase other risk factors for health issues. So definitely not something that it would be a good idea for everybody across the board, but worth a discussion as well.
Okay. And now, how does something like loneliness or social isolation influence heart health for women?
Absolutely. And we saw this a lot undergoing COVID and peak COVID. We're
Yeah.
very much isolated, very much lonely, not going out there, not being social, and not having that interaction that can potentially be helpful for not only physical health, but also mental health. So the more our mental health plays a role in our sedentary lifestyles, the more we place ourselves at risk. And we're definitely seeing an uptick in mental health issues across the board in every gender and socioeconomic status. So definitely something that we need to look into a bit further.
Okay. And are women more prone to developing conditions like broken heart syndrome or stress-induced cardiomyopathy? And if so, why?
Absolutely. So we're seeing, going back to the estrogen levels,
Yeah.
we're seeing that Takotsubo's or broken heart syndrome is affecting women after menopause at an exponentially higher rate.
Wow.
Broken heart syndrome affects women disproportionately a lot more than men. 85% of these cases are women as opposed to men. So definitely estrogen plays a role into it. Also, as we discussed before, increases of heart disease after the age of 50 or after perimenopausal area. That's when we start to increase that the risk factor for Takotsubo's and broken heart syndrome. And then we're also seeing during pregnancy, women have a higher chance of having sudden coronary artery disease and sudden coronary artery dissections. This is when the arteries of the heart, they essentially kind of almost split open, in essentially putting women at risk for those symptoms very similar to heart attack.
Okay.
And that is something that affects women in pregnancy a lot more than any other population. So definitely this is a hormonal issue that affects women for sure.
Interesting. Now, how can women, balance mental well-being and physical health to lower their heart disease risk?
I think you have to kind of sit down and look at your lifestyle, look at what fits your day-to-day lifestyle, and just do anything you can. It has to be very intentional. What you put into your body, what you eat, how you cook, the education that you get when it comes to your risk factors, the appointments that you keep with your primary care doctor and your specialist moving forward. So essentially, you have to be very intentional about these little nuances.
And, what do you think heart disease in women is still, why do you think it's, still so frequently misdiagnosed? Do you think it stems back to that lack of research and education?
Absolutely, absolutely.
Yeah.
So we didn't take women as seriously. We didn't include women in these studies, so we're not as well versed in knowing the symptoms, knowing the risk factors. And still to this day, our studies and our research, going back to that representation, we're not representing women as we should. Even from the scientists that are conducting these studies. When I looked back in the past decade, even up to 2020, up to the year 2020, women made up only 20% of the editorial boards in medical journals. This is looking across about 740 studies of research studies. And there were zero, absolutely no
That's
women
crazy.
editors in chief of any of the major players
Wow.
of any of these publishings that affect women. So definitely from top to bottom, women are disproportionately not being represented in studies, in research. And even now, when it comes to new research, new treatments, new screenings, women are not very well represented in that arena either. We make up about maybe 15% in research in those studies. Most of women are included in lifestyle modification studies, but not necessarily the treatments and the new screening studies that are out there.
Wow. Offhand, I don't know if you're aware, but I mean, are there any other, countries that may be more advanced that have included women in, this cardiovascular research that's a little ahead of us
It
or?
absolutely. So I would say more of the Scandinavian countries that
Yeah.
are a little bit ahead of us, but definitely the United States falls short time and time again, which is very, very
Hmm.
disappointing.
We need to follow some of their methods.
Absolutely, yes.
Okay. If there was one thing that, you wished that women could know about their cardiovascular health, what would it be?
Just not ignore their health. I want women to use this month as basically a reminder that they need to make that appointment. They need to kind of step back from from their responsibilities day to day and carve out time for themselves to speak with medical professionals. Now, especially at RUMC as well, we're employing a lot of telemedicine. So it doesn't mean that you must go in person to have your health checked. It could be something as simple as picking up the phone, making one of these telehealth visits, and speaking to your provider to see should you come into the office to get something checked. Should you have your your labs checked, your blood pressure checked. So definitely, I want women to get out of this as a reminder that they need to take care of themselves.
Absolutely. And that's such a convenience to have that telehealth option. People are
Absolutely,
so busy, so it's
yes,
definitely a
yes.
tool that gives you no excuses.
Exactly that, yes.
Okay.
I've even called patients at 9, 10 p.m. because that's the only time they could potentially have a phone call, and that's fine. I will
Wow.
tailor that to their
Oh,
lifestyle for sure.
that's so accommodating of you. How can women advocate for themselves in healthcare settings, especially if they feel that maybe their symptoms aren't being taken seriously?
So I tell patients and women especially that picking a good provider or picking a doctor that listens to you is just like any other relationship. You want to have someone that not only will listen to your symptoms and take a good history and a good physical, but somebody that will tailor what you need to your lifestyle, to your past, to what you can handle within your day to day. So it definitely is a good idea to choose a provider that will listen to your symptoms,
Mhm.
and you have to be your own self advocate because you know your body best. So you know what feels off, you
Oh,
know
yeah.
what feels okay, you know what your family has gone through and what your risks are and how you live your life day to day. So it's very important to have that relationship with your medical provider. It's not just a one-way street where you're told and given some medications and that's where it ends. It's an ongoing story, and risk factors they change month to month, year to year. So it's always a developing story, and you need to be your own best self-advocate.
Mhm. So, can you share maybe any resources or organizations or tools, that women can use to educate themselves about cardiovascular health?
Sure. So I think it starts as simply as even community outreach programs, even reaching out to your religious community to see if there's anything going on. I know that you and I we've
Yeah.
taken part in a lot of community outreach programs and screenings. So it doesn't have to be anything huge like that.
Yeah.
But going to more a government funded program, the CDC has what we call Wise Woman, and that tailors screenings and comprehensive medical care in women starting at as early in their 30s all the way to their 60s. So there definitely are resources out there. You just have to know where to start. And something as simple as speaking to a friend, speaking to a clergy person,
Mhm.
speaking to your medical provider, just to see what resources are out there in order to get healthier.
Wow. Well, thank you very much for all of that valuable information.
Thank you.
Let's, hope that this month women could really prioritize their health and get the screenings that they really need to prevent this, cardiovascular disease. And I would like to thank you so much for all
Thank
that
you.
you do to keep our community safe and well.
Thank you.
That about does it for this episode of RUMC Connections. But for more information on RUMC's cardiology services, please call 718-818-7414 or visit rumcsi.org. That about does it. Thank you so much for joining us. I'm Meredith Gaskins.
Thank you. Thank you for having me.